Hello, my name is Adrian, and I'm a two-time GYN cancer survivor and advocate for awareness of gynecological cancers in Black women. I'm also a patient advocate with the Endometrial Cancer Action Network for African Americans, ECANA. I was asked to bring my perspective to the question of what responsibility the oncology practitioner holds in reducing health inequities in cancer care to this forum. While I'm never shy about sharing my experiences about my own barriers, my personal barriers to being diagnosed with cancer, I've had to approach this particular question a little more broadly. I could be dating myself with this colloquialism, but I remember saying that with something like, "You think I'm doing this for my health?" People knew it was a rhetorical question. It was meant to indicate that someone was doing something in the absence of purpose or as a waste of time. But I want to use this space here today to challenge how rhetorical that really is. I had an experience when I was diagnosed with my first cancer in 2003. It stayed with me all this time because I feel like it was the perfect storm of what happens to many Black women faced with the challenges of having to navigate the healthcare system when they don't have the proper education about their cancer risk or familiar histories of cancer. I believed I was in an early pregnancy and I was having some light spotting, so I drove myself to the ER. I was alone, unmarried, and uninsured. I had no primary care physician or prenatal care to speak of, but I had a positive pregnancy test, and I told them that when I admitted myself. The first provider I encountered took one look at the ultrasound and immediately diagnosed me with having an ectopic pregnancy. He wanted to rush me right into surgery, no explanation, only that I was young and I could always have another baby. But if I didn't have this surgery right now, I could lose my life. I barely had time to think or comprehend what it was that he was saying to me. But when the opioid call came in, he looked at the same ultrasound and said, "I don't know what this is right now, but I do know we need time to find out, and I wouldn't recommend a surgery at this time." So I had this one experience with two different providers and two different experiences or diagnoses, and I had to make this one difficult decision. In the end, I went with the one who wanted to give me time. A week later, that OB called to tell me that what presented as a positive pregnancy test was actually an ovarian cancer. I didn't feel scared or angry at that time. I felt confused. How was it that one doctor took the time of 5 days to diagnose this very important thing when the other barely took 5 minutes? I do know now that inside of that 5 minutes, a grave mistake would have been thrust upon me. So why is it that one doctor was willing to risk my life when another was willing to take the time to save it? That experience really taught me how delicate time is and what a valuable resource it is to cancer patients who often face intensely difficult circumstances inside of high stress environments. And that is where I think you'll find a measure of provider responsibility, how they use the time that they have with their patients. Slide, next slide. Providers can use time to be deliberate about relationship building. By focusing on building relationships with patients, providers are better able to appreciate the value of patients' lived experiences and better determine the next steps for them, whether or not they need to be diagnosed or how they're going to be diagnosed and how they should be treated. Relationship building also allows for time to assess the patient's ability to understand the benefits and risks associated with treatments or any surgeries or things, other medical interventions you are proposing. Relationships also are a critical bridge to building trust between providers and patients. And that's going to greatly influence how well patients not only adhere to treatment plans, but also share in the responsibility for outcomes. Next slide. Providers can decide how to best cultivate relationships by taking the time to make sure that patients are informed and feel empowered about their own care. Ultimately, they're allowing the patients to respect the fact that it's their body and their decision. When providers are decisive about investing time into patient-centered care, the result is often a partnership that prioritizes patients' needs, reflects the patient's reality, and is consistent with the patient's voice, not only in theory, but also in practice. When providers see patients as partners, they take time to share information and communicate respectfully how care plans are carried out, and not just assume that patients know or should necessarily agree. They can also decide to communicate with language that is compassionate so that the patient not only understands, but feels like they are also understood. Next slide. Providers can dedicate time to finding solutions. Solutions that include developing standards of care that eliminate barriers to potential treatment options, so patients can view things as being more favorable to them or more aligned to their lifestyle. Solutions for care that do not further aggravate the condition of a person's reality, but realize that they are already disproportionately affected by cancers, and they already bear the brunt of stigmatization when they are diagnosed. Providers can dedicate time to solutions that include social and mental health services and treatment plans so that it helps to maintain a patient's quality of life during treatment, so they can also feel valued and dignified while they're going through treatment. Slide. Lastly, taking time is fundamental to defining patient experiences. These experiences lead to patients who feel seen, heard, and in cases such as mine, still here today to tell their story. So the rhetorical question of, you think I'm doing this for my health? In the spectrum of health equity has the resounding answer of being no, you are doing it for mine, and I am not a waste of time. Slide. Again, I am Adrian, stage 1 ovarian cancer survivor, stage 3 endometrial cancer survivor, patient partner to Dr. Kimmy Dole, director of peer supporters for the sister study with Dr. Kimmy Dole, and steering group member and ambassador with the Endometrial Cancer Action Network for African Americans. Thank you for your time.